Hello everyone! Today we're going to talk about laser vision correction. So do you suffer from problems or weakness in your eyesight for many years? Does your appearance bother you with glasses and you want to get rid of them? Fortunately, there's a solution to this problem, and it is the LASIK operation. LASIK eye surgery is the best known and most commonly performed laser refractive surgery to correct vision problems. After watching this video, you'll be able to know everything related to this magical operation, the indications for resorting to it, the result of the operation, and possible side effects of the operation. Our role today is to answer most of your questions regarding laser vision correction. Today we have Dr. Peck, who is a leading doctor at BGN Eye Clinic in Cannes. He is going to discuss with us everything about laser vision correction from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Peck.
Hi.
Nice to meet you.
Nice to meet you.
So before we start our interview today, can you please introduce yourself to people who are watching us?
Okay, I'm Dr. Beck from BGN Eye Clinic. I'm an ophthalmologist and I'm a refractive surgery specialist.
Nice to meet you.
Nice to meet you too.
All right. So straightforward to my first question. What is myopia?
Well, myopia is simply nearsightedness. It's a common eye condition where light focuses in front of retina instead of focusing on the retina. So it causes objects in the distance to look pretty blurry and close objects to look clear. It's caused by a combination of generic and environmental factors, such as spending extensive time on focusing on close objects, time indoors, and family history. Prevalence rate of myopia is roughly 20 to 50% in the United States, so it's pretty common.
So how do you usually diagnose myopia, and afterwards, if it's confirmed, how do you treat it?
Diagnosis of myopia is made by the eye specialists. Refractive error can be measured objectively using autorefractor and manual retinoscope. The short-term solution to this refractive error is using eyeglasses or contact lenses. The long-term solution would be laser vision correction.
All right. So you talked about laser vision correction, something we hear a lot in everyday life. What is it exactly?
It's an alternative to wearing contact lenses or eyeglasses by changing the focusing power by reshaping the cornea. So it's a long-term solution to eyeglasses or contact lenses. So how safe is it, laser correction? Is it safe, or is contact lenses more safer? Well, there are benefits and disadvantages to both contact lenses and laser vision correction. Both would be great if you don't like wearing eyeglasses. But for contact lenses, there's always a risk of infection, and it's inconvenient. And you'll have to get used to putting them on, touching your eye every time. And it's not safe to sleep or go into water with it. But the other hand, laser correction is a long-term solution, as I said. It has less risk of infection, but the downside is that it can cause dry eyes. You might experience glare or halo effects, and there's a rare risk of surgical complications. So in what cases will vision correction help restore vision? In what cases can you suggest having this surgery done? Nearsightedness, farsightedness, presbyopia, astigmatism are all considered refractive eye conditions that can be corrected using a laser vision correction. But all eyes must be fully evaluated for candidacy, safety, and efficacy. Is there a certain age where you can have laser vision correction? Well, laser vision correction is suitable for all ages over 18, but although there is no limit, studies have shown better visual outcomes for the ages under 40 compared to ages over 40. And eye conditions tend to change after the age of 40 with presbyopia kicking in, and after the age of 60 with cataract and other eye diseases. Okay. So still talking about laser vision correction, are there any contraindications to this procedure? Well, all eyes need to be fully examined before the surgery for adequate corneal thickness, corneal shape, and refraction for each of the surgical methods. Well, possible contraindications include ages younger than 18, unstable refraction, pregnancy, severe dry eyes, active corneal infection, and some autoimmune diseases or diabetes, glaucoma, or some medications that can cause severe dry eyes.
So how do people tend to prepare for the laser vision correction?
Well, it's pretty simple. You just need to have full evaluation to determine whether your eyes are suitable for the laser eye surgery. To do that, you need to take off your soft contact lenses for 5 days, at least 5 days, and toric and RGP lenses for around 2 weeks.
So let's talk about more details about the surgery itself. How is it done?
So we use pulses of laser beams to remove corneal tissues. Cornea is reshaped using a laser so that light focuses on the retina of the back of your eye. All procedures take about 15 to 20 minutes. So it's fairly short, but it's a long-term solution, so it's very convenient.
Very nice. After the surgery, is it possible to be active physically? Is it possible to do sports, for example?
Yes, it is possible to play sports after 1 or 2 months after the surgery. But for the people who are at risk of eye injuries, such as boxers or military soldiers, can be exposed to possible risk of future flap complications. So they should avoid LASIK with an I, and they should choose LASIK with an E or SMILE instead.
Okay. So you just talked about LASIK and LASIK. What is the difference?
Well, they're both great and safe processes of reshaping the cornea using laser. But the main difference between them is how cornea is opened to allow the laser to go through. During LASIK with an I, first laser creates a thin flap. We use 20 millimeters of incision to open the flap, and after lifting the flap, we use second laser to correct the refraction. The recovery process is very quick, and you'll be able to work and see within 24 hours.
Okay.
LASIK with an E, on the other hand, thin surface of the cornea is removed using an alcohol solution or a mechanical brush, and the laser is applied to reshape the cornea. Recovery process takes roughly around 2 weeks, but the good thing is that LASIK can be performed to people with thin corneas and higher level of myopia.
Okay. You also mentioned before SMILE LASIK. What is it exactly?
Well, SMILE LASIK stands for small incision lenticule extraction. It's a newer treatment method. It works using a femtosecond laser, and it creates a lenticule layer within cornea and a small 2 to 4 millimeters of incision. Then the lenticule is removed by the surgeon, changing the shape of the cornea. It's a flapless procedure, so it's suitable for patients with dry eyes or other surface problems. Recovery time is quickest, and it's most comfortable during the recovery process.
Okay, very nice. So prevention, let's talk about prevention of eye diseases. What do you advise for people watching us?
Right. To keep your eyes healthy, first, get regular eye exams. Visit your local ophthalmologist. Be aware of vision changes. Wear UV light protection. Eat healthy. Reduce alcohol consumption or smoking. Exercise, prevent diabetes, and most importantly, rest your eyes.
Okay, so it's all advices for every kind of disease.
Right.
All right. Thank you, Dr. Beck.
Thank
for
you.
your time.
And thank you for your time too.
Very informative interview. Thank
All
you.
right. Thank you so much.
So today we learned many things about laser vision correction. And the doctor explained in detail everything related to this operation, such as indications for it and results after the operation. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.